Good morning.
Good morning.
Brian?
Yes.
I'm PJ.
Nice to
I'm
meet you.
the head physical therapist at this office. So, Brian, I'm taking a look at your chart here, and it looks like what you're coming in for is some low back pain. Is that
Yes.
true? Now, Brian, what do you do for work?
I'm a construction worker.
Okay. And is that how this low back pain came on?
Yes.
Okay. Can you tell me a little bit about what happened when it came on? Lifting something heavy or anything like that?
About 3 months ago, I was lifting cinder block, and my low back started to hurt, and it just hasn't gone away.
Okay. And is it like a consistent thing lifting these cinder blocks, or this is just the one day?
It's pretty much every day at work.
Gotcha. Okay. Now, Brian, on a scale from 1 to 10, 10 being the worst pain imaginable, 0 being no pain at all, would you rate your pain today?
At work, it's about a 7, but it does seem to go away
Okay.
when I stop moving.
Okay. So it seems to go away when you stop moving. Good. And you said today it was, so you're not moving, so today would be.
I just got back from work, so it still hurts.
Okay, all right. Fair enough. So I'm just going to ask you a couple questions here. Have you had any recent fractures or anything like that recently?
No.
No. Okay, great. Any metal in your body due to surgeries or anything like that?
No.
Okay. Any risk of cancer or anything like that you may have?
No.
Okay. Pacemaker?
No.
Peripheral vascular disease, or also known as PVD?
No.
All right, great. And last one, have you had a hemorrhage or doctor may think you may have something like a hemorrhage or anything like that?
No, I don't have any.
Okay, awesome. So based on some of the information you're telling me, Brian, I think that TENS therapy would be great to reduce that low back pain. So I'm going to go set some things up in our other room, and we'll wash my hands, do some things, and then I'll meet you right back there and we'll get started on that therapy.
Great.
All right?
All right.
See you in a few. All right, Brian, so this is our treatment room. So this is where we're going to be doing the TENS therapy. So just wanted to explain to you a little bit about TENS. So what we're going to be feeling in your lower back is just basically like a minor tingling, something like that. Have you ever had like any type of like massage gun, or maybe you have had TENS before? Have you ever had TENS before?
I have had that before.
Okay, so you're familiar with the sensation.
Yes.
So basically what we're going to do is we're going to feel a little bit of a tingling sensation, but we don't want a muscle contraction because we want to dull that pain that you're having. All right, so here are some of the equipment. So first, I'm going to have you lay down on your stomach, and I'm going to pull your shirt up to reveal your lower back. I'm going to wipe down your lower back to make sure everything's clean with an alcohol swab. And then we're going to put the pads on, and then we're going to get the machine all set up.
Great.
All right, let's do it. So, all right, Brian, you can come and lay on your stomach on the table. But before you do that, now you've had TENS before. This therapy is going to require me to put my hands on you. Is that all right with you today?
Yes.
Okay, awesome. So you can come up in here and you can lay on your stomach for me. If you want to take off your glasses just to be able to lay down comfortably on this pillow, you can do so. I'll hold them. I'll take them for you. Good. All right. And any pain in your lower back when you're laying down or something like that? You want a pillow under your waist or anything?
No, it feels okay.
Okay. All right. So what I'm going to do is I'm going to go to the lower back. First, before I start, I'm going to do a capillary refill test on you. Good, and that's within normal limits, so we're good there. So we're going to wipe you down with the alcohol swab first. Make sure everything's clean there. Maybe a little cold. Sorry about that. And then we'll get these electrode pads on you, okay?
Okay.
All right, perfect. So all clean. And then what we're going to do is we're going to get our pads placed on there properly. I've already set up the settings for you, so we are good to go. Okay. So what I'm doing is I'm putting this lower back, kind of in line with the erector spinae muscles there, probably the ones that are spazzing up on you a little bit, causing you that pain. And maybe a little cold. Is it cold?
It's a little cold.
Okay. All right. Nice. Okay. So, Brian, I'm going to start off with a really low setting here. We're going to start off at 150 megahertz. and we're going to slowly increase the intensity. And the time for this is going to be about a 15-minute treatment. So I don't know how long you had TENS before, but that's a treatment time that we'll have for you today. All right, so we'll get started. As you can see, the settings are already set, so we're good. And all right, let me know when you feel a little bit of tingling, all right?
Okay.
So intensity's up to 3 right now. Any feeling at all, tingling or anything?
I'm starting to feel
Starting to
something.
feel? Okay. Go up a little bit. Anything yet?
A little bit.
Okay. Ready?
Now I'm starting to feel the static.
Perfect. All right. So go stay right there. That's about a 6 intensity level. Good. And we'll have that set for you for 15 minutes, Brian. And I'll be here monitoring you, making sure we're not getting muscle contraction and you're fine through your whole treatment of therapy today. Let me know if you have any problems, any pain, any tightness, anything like that, all right?
Okay.
All right. Enjoy. Oh, Brian, it looks like the 15 minutes is already up. So what we're going to do is first we're going to slowly decrease the intensity. So from 6 all the way down to 1, and then 0. Perfect. And then we're going to shut off our machine. Awesome. And what we'll do is we'll do charges and then remove the electrodes from you. And you may have a little bit of residue stuck on your back. You might feel a little bit of actually hair come off here. And this residue may stay on there for a little while. You don't have any allergies to any type of electrode pads, do you?
No.
All right. Great. So your back should be fine there. Put your shirt back down, and we'll do a capillary refill test first. Make sure you're fine after that treatment. 3. Perfect. Well, now Brian, how would you rate your pain from your TENS therapy today?
2 out of 10.
2 out of 10. So we went from about a 7 out of 10 to a 2 out of 10. That's great. I would say that's a successful therapy session for today, Brian.
Great.
All right. You can get up and you can go see Judy in the front office.